Hi, this is Sophie here at Hope Pharmacy with pharmacist Sadaka Chow. Today's 10 questions are on Albuterol Inhaler, so let's start. Hi, Sadaka. What is albuterol and what is it used for?
Hi, Sophie. Albuterol is a class of medications called a bronchodilator, which is used to treat and prevent symptoms of asthma, chronic obstructive pulmonary disease, or COPD, and other respiratory conditions. It works by relaxing the muscles in the airways, making it easier to breathe.
Okay. And how do I use my albuterol inhaler?
Yes, there are some steps for that. You want to shake the inhaler well before each use, breathe out fully, then place the inhaler mouthpiece in your mouth, and you close your lips around it. You press down on the inhaler to release a puff of medication as you start to breathe in slowly. You hold your breath for 10 seconds, and you breathe out slowly after that.
Got it. And how often should I use my albuterol inhaler?
You want to use your albuterol inhaler as directed by your doctor. It's typically needed to relieve symptoms of asthma or COPD, such as when you're wheezing, having shortness of breath, and chest tightness. But if you find yourself using it more frequently than prescribed, you want to discuss that with your doctor.
Good to know. What should I do if I miss a dose of my albuterol inhaler?
If you miss a dose or a puff, use it as soon as you could remember. However, if it's almost time for your next dose, skip that missed dose and continue your regular puffing schedule. Don't double
Okay,
up.
got it. Um, what are the potential side effects of albuterol?
Some side effects may include trembling or shaking, some nervousness, headache, dizziness, some fast or irregular heartbeat, and some throat irritation. But if you experience severe side effects such as chest pain or really rapid heart rate or difficulty breathing, you want to seek medical attention immediately.
I see. And how should I store my albuterol inhaler?
You want to store your inhaler at room temperature away from moisture, heat, and direct sunlight. Don't puncture or burn the inhaler, even if it's empty. Keep it out of reach of children.
I see. That's good to know. Can albuterol interact with other medications I'm taking?
Yes, it can. It can interact with certain medications, including beta blockers, monoamine oxidase inhibitors, or MAOs, and diuretics. It's very important to inform your pharmacist about all the meds you're taking to avoid any potential interactions.
Okay, got it. And how long does it take for albuterol to actually start working?
Albuterol is another name for it, is a rescue inhaler. So it typically starts to work within a few minutes of inhalation, with the maximum effects occurring usually within 30 minutes. It's important to use it as soon as you experience any symptoms of asthma or COPD for the best results.
Okay, got it. Is it safe to use albuterol during pregnancy or while breastfeeding?
It's generally considered safe to use during pregnancy and while breastfeeding when you need it to control your asthma symptoms. However, it's essential to discuss the risk and benefits with your doctor before using any medication during pregnancy or while breastfeeding.
Perfect. Last question. How often should I clean my albuterol inhaler?
That's a really good question. You want to clean your albuterol inhaler regularly to prevent any buildup of medication residue. Wash the mouthpiece with warm water at least once a week and let it air dry completely before using it again. Do not use any detergents or cleaning agents on the inhaler.
Awesome. All right. Well, that's all the questions I have. Thank you, Sadaka.
I take care, Sophie.
Bye.